I'm not a scientist. I focus on the issues that impact cancer patients and their family. What are the policies that employers need to adopt to ensure that their employees have access to these treatments, have the resources at work, can take the leave, can adapt and accommodate their jobs while they're going through treatment?
I think as an employee who was dealing with cancer personally, it's a really scary time, and there's a lot of uncertainty. And my company's benefits team, they were informed and empathetic, and they put some certainty in my mind about things like what was my schedule going to be like, and how did the disability program work, and so they provided great support, which makes it one less thing that you have to worry about. You're still worried about a few things, but the work schedule isn't one of them, and the paycheck isn't one of them.
In January of 2016, my husband was diagnosed with esophageal cancer. And while he was at the hospital doing testing, getting more information, I moved up a mammogram, a routine mammogram, and I got diagnosed with triple-negative breast cancer. But it's a lemonade because it was stage 1, so I was very, very lucky and so fortunate that I maintained focused on my screening and self-care as well. So my husband and I both went through cancer, and we're both doing well today, but it was a very complex journey being a patient, a caregiver, a primary caregiver.
I was 11 years old and I was diagnosed with bone cancer, the exact same cancer that Ted Kennedy Jr. was. And to meet him today was very inspiring because when you're an 11-year-old boy and you get a bone cancer diagnosis, when you're playing sports and doing all that type of stuff, first you think you're not going to live. And my mom used to bring me videos and pictures of, I said, well, Ted Kennedy's son had the same thing years ago, and look at, he's skiing and he's doing this. So to meet him today in person was a full circle moment.
It's nice to say nice. Yeah.
I had been cancer-free for about 20 years, and then I had 2 successive cancer diagnoses very close to each other. It was actually after my 3rd diagnosis. I had a melanoma diagnosis that was small and caught early, and then just a couple years later, I was diagnosed with a small, another sarcoma. It's again caught early, but when I went back to my sarcoma specialist surgeon to have the surgery and have it removed, he at the time recommended that I consider genetic testing, that this is too many very uncommon cancers for one person to have in their life. And so we went through the process and got tested, and it came back that I had a syndrome called Lee-Fraumeni syndrome. If you're a male and diagnosed, you're going to have about a 95% chance of having at least one cancer, if not multiple cancers through your life. Women have almost 100%. They have an increased risk of breast cancer on top of the male patient population. So you're going to get cancer, you don't know when. Many times these types of cancers for Lee-Fraumeni patients pop up when you're young, and that's when they first catch them, and then they can monitor. There's no cure, there's no treatment for the syndrome. You just watch very carefully and try to catch any cancer that is coming. But they also shared, when they shared the diagnosis, that there was a 50-50 chance that our 2 daughters, Madison, who at the time was 8, and Riley, who was 4, that this is a hereditary genetic mutation, and that there's a 50-50 chance that they have it. So we did get them both tested. And unfortunately, that 50-50 chance for us was 100%. Both girls, both Madison and Riley, tested positive for the Lee-Fraumeni syndrome mutation. And so the 3 of us at that time became sort of the traveling MRI bandits. We were always, you get a lot of MRIs, both full body, you get brain MRIs, you get a lot of ultrasounds, a lot of blood work, you get a lot of dermatology, you get colonoscopies and bronchoscopies much earlier in life and more frequently. And we did these testing on an annual basis to look for cancer. So my oldest daughter, Madison, who's now 20 and is a college student, her scans since 2013 have all been clear, which has been fantastic. Our youngest daughter, Riley, started at 2013. Her and I were sort of almost kind of got off the scanning only train at the same time. Just after I was diagnosed, we found out that in her scan that they saw a small brain tumor, and that was in April of 2019. And then we lost Riley on January 14th, 2024. And the medical team did a phenomenal job managing 3 different cancers simultaneously for her to still have a relatively quote unquote normal childhood. She had just started as a freshman in high school and made the golf team and was very proud of that, and got very sick right after Thanksgiving. She went very quickly. Within less than 5-6 weeks, she passed. And so, now there's just 2 of us on that scanning journey.
Where should this field be going, and what should we be doing with it? How do we ensure that AI works for all of our patients? We talked about bias and skin tone. I also think that community engagement, understanding what the communities that have had their data be used to train AI and what the patients that are in front of us are having AI be used on is going to be really important for asking that question.
By and large, the biggest impediment for someone getting a basic screen that's covered is not that they're afraid. It's not the financial, etc. It is literally the friction of access. It's every single step that people are made to take causes attrition.
Another item that employers want to think about is the diagnoses for young adults these days. And really, if they can lean into that preventative care and fostering the ability for screening, education, and supporting and understanding that cancer has changed a lot.
I think that there's a lot that employers can do to make sure that cancer treatment, caring for people with cancer, accommodating people in the workforce can be in the vanguard, can be in the forefront of the national conversation. I'm Ted Kennedy Jr., and I'm one of the voices of the Northeast Business Group on Health.
I'm Atman Laraki, and I'm one of the voices of NEBGH.
I am Heather Batt, and I am one of the voices of NEBGH.
I'm Josh Hudson, and I am one of the voices of NEBGH.
I'm Ryan Monahan, and I am one of the voices of NEBGH.